Anna,
Yeah,
thanks for joining me.
yeah.
How are you?
Nice to meet you. I'm fine, and I'm excited that I find your spot here and
Yeah?
can tell you about Health Huddle.
Yes, yeah, go. Well, yeah, tell me about you, what you do, problem you solve. Yeah, let's get into it. Who are you? What do you do?
Yeah. I'm physio from Ukraine, and I got a master's in public health here in Oxford Brookes University, and I want to use it for health promotion, for improving health literacy, fighting health misinformation, and I find it quite difficult to have funding to move social projects. It's nice as a volunteering, but generally it's not a system that really works. And
What is it about the system that's so difficult in getting funding for this kind of thing?
public health promotion and prevention, and nice things that we are hearing all the time from NHS.
We need a healthy population, though, don't we?
Yes.
Why are they not promoting this?
Yes, it's challenge. But I'm thinking that it's possible to connect business with these social needs, and it will be win-win for everyone. So I have experience from Ukraine. My Ukrainian-speaking podcast, DOCAS. It's for evidence-based conversations with doctors, me as a host, and I'm asking just simple questions that these doctors have during their appointments all the time.
Yeah.
And I show respect for doctors. They just need to come and sit in a nice place and talk for an hour. And we have a lot of content, and people have this content, and we can communicate. And it's great, I think.
I think that's really good what you're doing, though, because I think connecting business is incredibly important as well, because we need a healthy workforce, not just a healthy population, but we need a healthy workforce to increase the economy, to make the economy more sustainable, and also to protect the younger generation as well, because it's them that are going to be paying for us when we get older, right?
Yeah.
And it's like, why is this? So is it a political thing that's making it really hard?
You know, I'm a new person in this country, so I can't understand really like what's the problem. So I think that NHS
that is a whole can of worms.
is what I'm finding as a young entrepreneur. So I am part of Oxford business ecosystem, and I'm like in this area of this open-minded, creative people. And when I speak about NHS and healthcare and something like we don't know. It's like something so complicated there. So so business people, they tried not to reach out like NHS as a customer, or it's so yeah.
The NHS is a complicated beast. It's so. I mean, for a lot of people think it's a broken system. A lot of people think it's an outdated system, but it's incredibly complicated because it's made up of so many just incredibly different parts, and no one really talks to each other.
It's normal, and I personally, I think they do a really good job trying to support people as much possible, better than they can. But at the same time, it's responsibility of people, their own health, and knowing about their health, and not only relying on appointments. Because it's understandable that people want to see their GPs all the time, not to have a phone call or robot or sending to website for information. But it's what it's all about. Like podcasting, it's great. I think it's like save time. And everybody will be happy.
Yeah, well, I certainly think so.
Yeah.
What's your background then? Like, how did you come to be this? How did you come to get to where you are now?
I'm physio from Ukraine, so as I said, I have 5 children, and it was like my main job back in Ukraine. And I also support people as health coach there, and it was like private work. And I see that this problem from healthcare professionals, like they need to answer same questions all the time, and it's exhausting. And people sometimes, it's understandable that people ask this question, but it's so time consuming. And as I said, like I done masters here in public health. I want to use it, like scale it and help more people.
That's really good. I think What's really interesting about this medium is that, you know, as podcasters and using video assets and marketing assets, it helps you scale a message, and it can be there for years, and it's there forever now on the internet. The thing with medical, though, and it's something that maybe you can answer, is that everybody thinks that their medical thing is unique, though. Like, it's all about, but I have this problem. Can you answer my problem? What would you say to that, though? Like, everyone thinks they need their personal question answering. Like,
Yeah, it's understandable, and I'm up to personalized care and things like this. But a lot of problems, a lot of questions are quite general, and
Right.
if doctor can explain it to people, like, okay, you can do this first because this and this and this. As I said, it's time consuming. So if somebody receive like same answer for their question like this, so they can rely on it, and to get to this point where people need special treatment and special care, it's like not a huge percentage of situations. So
Right.
it's like first stage of communication, maybe.
Yeah.
So, and if now we are speaking about 10 years plan from NHS, and it's nice, communities, digitalization, prevention, it sounds great. But I think that healthcare professionals are not so optimistic about this, because
No.
what kind of changes do they want to do?
Yeah.
So they want to reduce like specialists or what? So I think that we can work all together, and more spaces where communities and people can reach out.
I think
This audience.
there's someone. Have you heard of someone, a YouTuber called Ali Abdal?
Maybe
He's quite a prolific
yeah.
YouTuber. So he used to be a doctor,
Yeah.
and then turned YouTuber, and his whole YouTube channel was about helping medical students pass their exams and do their entries into medical school. And now he's like a generic YouTuber. Well, I say generic YouTuber. He's a big YouTuber.
Yeah.
I think you should definitely reach out to him, because I think he would be able to help you get the message out like a lot wider. I mean, this is great, obviously, like, you know, you chatting here today, but because of his background, he's got that medical background. He knows that medical system probably as well as you do as well now. And I think he would be able to really raise your profile. So hopefully we can, when we get the recording of this, when this comes out, let's send it to him and see if he can help you, because I think he's got an incredible profile, incredible reach. And I think he could really get behind your cause. I think that'd be amazing.
Yeah, I would be really grateful. And you know, my point is again, like, a lot of information online about health, but we have this problem of misinformation.
Misinformation, absolutely,
and it's huge, and it's underestimated problem. And when we have these big accounts and people and branding, and of course it takes time, but at the same time, the more the better. And if local medical practices have their own YouTube channels,
Yes.
it would be great.
Yeah,
You know.
I mean, you see it with like, you know, like aesthetics clinics and, you know, those kinds of things, dentistry clinics as well. They're really good with like information, and it's like usually with their FAQs and, you know, being able to put how they do things and like their opinion on things. But general medical, general health, like it's not a part. So I completely feel
lack of funding, and of course they're busy, and it's completely understandable. I'm volunteering in our medical practice for more than a year, and I see this like gap. So they're happy when I'm doing something, recording something for them, but it's as a volunteer, you know, like they don't have role for such kind of job.
So what do you need? Like, you say you're like trying to get funding. Like, what funding do you need? Where do you think you can get it from, or should you be getting it from? And how much do you need? And just in case anybody's watching this who loves this, what you're doing and wants to get involved, like, what kind of funding do you need? What are the things that you need to move forward?
I am setting up a YouTube channel. So we have already recorded some videos with doctors, with professionals. So I would do it anyway.
Yeah.
But of course, I have this experience from Ukraine. When you just need to come to nice studio and receive nice edited content, and somebody can download it right to the algorithm and everything, and you just need to post it all the time.
Yeah.
So it's kind of work. It's huge. I know that what you're doing, it
Yeah,
seems simple, but it's amazing class of work. So that's why I think like I'm open to conversation, to partnership with everyone and with any business, because it's so easy to connect. I think I can connect any business with health, because health is everywhere and it's personal to everyone. So yes, if you have like somebody who is interested and open up and have any feedback on this topic and just like and keep going, it would be really helpful.
Amazing. Well, if anyone's watching this or listening to this that wants to get into, how can they find you? Like, where are you online? What's your domain handle? You know, what's your domain? Your social handles?
Health Huddle UK. It's Instagram page, and it will be a YouTube channel soon.
Yeah.
Yeah. So we keep going, and you definitely will heard about Health Huddle, and I think that it's something that need to be everywhere. And I'm inspired from Startup Huddle in Oxford, from our ecosystem, and it's a nice and really inclusive space where different people can come and speak about business, share their ideas, and I think we need something about health as well.
I think you're right. You're right. We definitely need what you're doing.
Thank you.
Anna, thank you so much for coming on.
Thank you.
It was really good, and I think it's really important what you're doing. Health is wealth, right?
Yeah.
If you do not have your health, you cannot do anything else. And I think a lot of people take their health for granted. And I think what you're doing is amazing. And thank you so much for sharing it with us.
Yeah, thank you so much.
Cheers.